Welcome to the Introduction to Fatigue Management group session. My name is Vicky Eglinton and I'm a specialist occupational therapist in the MECFS service. You have been invited to this session as you are currently on our therapy waiting list to commence therapy intervention. I'd also like to introduce other members of the MECFS team. Vicky Patterson is a specialist occupational therapist and the OT lead in our service. Vicky Johns is also a specialist occupational therapist. Both Nikki and Vicky see patients for initial consultations. All of us work with patients offering our fatigue management therapy programme. As occupational therapists, we specialise in fatigue management but cannot offer advice and guidance about medical issues. Please discuss any medical issues you may have with your GP who coordinates your care. We are also not an emergency service, so if you have an emergency, please contact your GP, dial 111 or 999, depending on your emergency and circumstances. Today's session will last for no longer than 30 minutes. To begin with, I will be providing information to you by going through a presentation which will include an overview about the fatigue management therapy programme being offered in the MECFS service. I will also give a brief summary about fatigue and causes of chronic fatigue, and I will use both terms fatigue and chronic fatigue interchangeably. I will also outline key areas covered in one-to-one therapy sessions to help with management of fatigue symptoms. Finally, I will provide guidance on how you can begin to prepare for therapy intervention whilst waiting for therapy to commence. The aim of our therapy programme is to develop your knowledge and understanding about chronic fatigue. Some people may be more knowledgeable than others about fatigue. So when you start therapy, the therapist will establish where you are in terms of your knowledge and understanding about fatigue and fatigue management tools and strategies. Part of the therapy process is to also explore the various factors which are contributing to your chronic fatigue so that appropriate support can be provided to help you in making lifestyle changes, to help stabilise and manage the fatigue more effectively. I will talk about these various factors shortly. As specialist occupational therapists, we will be able to share with you strategies and techniques to help with management of fatigue symptoms. Part of our role may also include signposting you to other services or organisations, such as talking therapies, for example, if you are struggling with psychological factors such as low mood or high levels of anxiety, which may require more targeted therapy intervention. We may also be able to signpost you to welfare benefits if you are needing financial support and guidance. The therapy programme offered in our service is a self-management approach. Although the therapist working with you will be guiding and supporting you in fatigue management and sharing with you fatigue management strategies and techniques, the aim of therapy is for you to recognise your own triggers and what you may need to challenge and change over time to manage fatigue symptoms more effectively. Alongside therapy appointments, there are helpful and informative self-help resources in the form of videos and booklets that you can also refer to. These resources are usually sent electronically, so please do set up a folder on your computer or laptop that you can download and save the booklets and video links to. Otherwise, the information that is sent via our email system will be lost as emails expire after a certain time. Therapy appointments are approximately every 4 to 6 weeks and last for up to an hour. Now, we appreciate that an hour appointment can be a long time when you are struggling with fatigue and issues with concentration. So if an hour appointment is too long, they can be shorter, for example, 30 or 45 minutes. Therapy appointments are generally offered via video link using a video platform called Attend Anywhere. However, appointments can also be offered over the telephone if you have internet connection issues. Typically, we offer 4 to 6 therapy sessions as standard. However, the number of therapy appointments offered to you will have been discussed with you during your initial consultation, and therefore the number may be different for some of you, but they will not exceed 6 in total. Therapy is also tailored to the individual, taking into account how the condition is affecting you physiologically, psychologically, and socially. Following your initial assessment with a specialist occupational therapist in the service, hopefully you will have been emailed a video and booklet about the physiology of chronic fatigue. If you have not received this, please let us know via phone or email, and we will get these resources sent to you as soon as possible. Our email address and telephone number is listed on all our resources. Both the video and booklet go into good detail about the physiology of chronic fatigue, but in summary, one explanation of chronic fatigue is that multiple body systems become dysregulated due to threats on the body. These body systems include the autonomic nervous system, the neuroendocrine system, also known as the hypothalamic pituitary adrenal axis, or HPA axis for short, the immune system and metabolic responses that occur at a cellular level. Threats on these body systems may include things like a viral illness, injury, stress, or trauma. Any form of threat makes it hard for the body to achieve and maintain a state of balance or homeostasis, which is needed if the body is to function well. When considering what causes chronic fatigue, it is important to acknowledge that no two people have exactly the same presentation of symptoms. This is because we are all different with different lives, experiences, and medical history. However, there are some factors that are thought to predispose us or make us more likely to develop chronic fatigue. As shown on this slide, examples may include persistent stress, genetics, neurodiversity, hormonal dysregulation, lifestyle and social factors. In terms of what may precipitate or trigger the chronic fatigue, factors may include a viral episode, trauma, stressful event, long stress, surgery, or a serious injury. There are also factors that may be instrumental in perpetuating or maintaining the chronic fatigue, such as overexertion, lack of support, boom and bust cycles, stress, poor sleep, low mood, and high anxiety. Often there is a complex combination of a variety of factors, and as you will notice, factors can occur in all 3 areas. For example, if we have been living with prolonged stress, perhaps in relation to work or family life, we may stop recognizing the signs of stress and the impact it is having on our mental and physical well-being, because over time it can start to feel normal to us. In the Physiology of Chronic Fatigue booklet, there is a section where you can write down factors that you consider may have predisposed, precipitated, or perpetuated your chronic fatigue, which you may find helpful to complete. As highlighted earlier, hopefully you will have received the Physiology of Chronic Fatigue booklet and video. And you should also have received videos and booklets covering activity management, sleep, and relaxation. If you have not received these resources via email, please let us know by sending an email or contacting us by telephone, and our contact details are on appointment letters and all of our literature. When we think about how to manage and stabilise chronic fatigue symptoms, the key areas from a fatigue management perspective are activity management, sleep and relaxation. I will cover each of these areas in a little bit more detail shortly. As I mentioned earlier, there are likely to be many factors that are contributing to and perpetuating your chronic fatigue. As part of our therapy programme, you may benefit from additional support with other lifestyle areas as shown on this slide. For example, if stress is a key factor, perhaps in context of work and/or family life, you may benefit from learning how to manage stress more effectively. If you are struggling with your emotional well-being, being able to discuss difficult thoughts and feelings, and challenging and helpful behavioural patterns as part of therapy may be helpful to you. Support can also be provided to help you with getting back to work or study, or being able to continue with work or study whilst managing fatigue symptoms. As fatigue affects everyone differently, therapy is very much tailored to you as the individual, so that the most appropriate and relevant areas of support can be provided. A key area of fatigue management is sleep. Sleep takes up approximately 36% of our lives, so it is very important we are sleeping well to support our body to heal and rebalance. Common sleep problems for people with chronic fatigue include sleeping too much, not sleeping enough, struggling to switch off and go to sleep, sleeping during the day, waking frequently in the night, and having unrefreshing sleep. The resources you will have received about sleep will provide helpful information about understanding sleep, the sleep cycle, the role of the circadian rhythm, our internal body clock, which regulates our body rhythms, including the sleep-wake cycle. Although we think sleep can be a helpful strategy for managing fatigue, sleeping more than your body needs can be just as dysregulating as not sleeping enough. It is the quality of sleep rather than the quantity of sleep that is important. Prior to commencing therapy, please spend time working through the sleep booklet and accompanying videos so that you can start to develop your understanding about sleep and possible factors that may be contributing to your sleep problems. Sleep will be discussed further with you during therapy appointments to support you in establishing good sleep hygiene strategies and a good sleep routine. Learning to properly rest or relax is a key aspect of fatigue management. Although learning to relax can be challenging, it has long-term benefits on our health and well-being and is a very good way of regulating energy in the body. Our energy works best in the present moment, so engaging in relaxation practices that enable our body to rest physically as well as mentally can be very restorative. We may think we are resting when we sit down and watch the TV, or when we are on our mobile phones, for example. However, this still requires some level of cognitive energy and concentration. Equally, if we are sitting down to rest our physical body, but while seated we are worrying or thinking about lots of things, that in itself can stop the body from truly resting. When we are resting effectively, physical and mental tension can be released, enabling the body to renew and repair itself, which in turn can help improve the chronic fatigue. There are many different relaxation techniques. And examples include breathing exercises, meditation, relaxation, gentle movement, yoga, tai chi, guided imagery. What helps you to relax will be personal to you. If relaxation is new to you, or if you know you struggle with some of the suggestions listed here, don't worry. Maybe just explore and try different techniques for short periods initially, perhaps for 1 or 2 minutes. The key is to develop awareness of how you feel when you practice the relaxation response How do your muscles feel, your breathing, your heartbeat? Are you aware of where you may be holding stress in your body and what it feels like to relax and let it drain out? Perhaps consider what else in your life may help you to feel relaxed. There may also be things that make you feel re-energized. Maybe it is being outside in nature, feeling fresh air on your face, painting or listening to music. Again, you will hopefully have received the relaxation videos and a relaxation booklet for you to work through in your own time and at your own pace. You could begin to try different relaxation techniques or explore what you may find relaxing and recording them on the relaxation log contained in the relaxation booklet. Relaxation, also known as restorative rest, will be discussed with you in more detail during therapy. Another key area of managing fatigue is activity management. Other terms that you may have heard include pacing and energy management. Every task we undertake requires energy, and different tasks will require different types of energy, such as physical, cognitive, emotional, or social energy. Fatigue levels vary, so on some days we may feel able to do more than on others. Pacing is a helpful way of balancing our energy and activities to reduce the boom and bust pattern of fatigue. Boom is when you feel you have a little bit more energy and so carry out activities while you can. This can lead to periods of increased fatigue, meaning you then have to rest. Bust is when you are suddenly unable to function or perform activities, no matter how hard you push yourself. Balancing your energy and activities by pacing yourself can help to reduce the boom and bust pattern. You can pace yourself across a period of time, such as an hour, a day, or even a week, by taking restorative rest breaks, breaking activity and inactivity into smaller chunks, switching activities, adapting activities, and planning and prioritizing your activities. If any of this is new to you, including the terminology, please do not worry, as activity management and pacing will be discussed with you in more detail once therapy commences. A really helpful tool to begin to understand how you are using your energy is to complete an activity diary. There are a couple of examples of activity diary templates in the activity management booklet that will have been sent to you along with the activity management videos. In preparation for therapy commencing, we would like you to complete an activity diary for 1 or 2 weeks by writing down your daily activities and how long you are engaging in each activity for. Also consider whether the activity you are engaged in is high, medium or low energy demand as you perceive it, and you can colour code these in your diary. So activities that are high energy demand you will colour code as red, activities which are medium or moderate energy demand you will colour code as amber, and low energy demand activities you will colour code as green. On your diary, also note when you are sleeping and when you are engaging in restorative rest or relaxation breaks. And you could use different colours to reflect this, such as blue for sleep and purple for relaxation. At the end of each day, rate your fatigue on a scale of 0 to 10, so 0 being no fatigue and 10 being maximum fatigue. Just to show you, this is what a completed weekly activity diary may look like for someone who is struggling to manage and stabilise their fatigue and are in a boom and bust pattern. In this example, we can see that this person is spending time at the weekend, sleeping during the day. They are engaging in high energy demand activities for long durations, and there are no restorative rest or relaxation breaks as part of their daily routine. If your diary also looks similar to this example, don't worry. Your completed activity diary will be discussed with you during therapy to support you in working towards a more balanced routine to help stabilise the fatigue. So currently you are on our therapy waiting list, and once a therapy appointment becomes available, a letter will be sent to you via email with a link to attend anywhere at online video platform with instructions on how to join. However, there are things that you can start to do in preparation for therapy. So to recap, please work through the resources that have been sent to you, videos and booklets covering physiology of chronic fatigue, activity management, sleep and relaxation in your own time and at your own pace. Whilst you are watching the videos or reading the booklets, do make any notes that are relevant to you. In preparation for your first therapy session, start to consider what lifestyle changes you could make to help stabilise the fatigue. This may include exploring relaxation techniques and then making time for regular relaxation breaks during the day. You could also think about what factors may be affecting your sleep and start to consider how you can begin to improve your sleep routine and try different sleep hygiene strategies. Starting to make lifestyle changes does take time and is very much based on trial and error. Please also keep an activity diary for 1 to 2 weeks. Colour code your activities as high, medium or low energy demand. Please also record on your diary when you are sleeping and when you are resting or relaxing. Also score your fatigue at the end of each day using the 0 to 10 fatigue scale. And please email your activity diary to us, and our email address is on all our appointment letters. If for any reason you have concerns about completing and sending across an activity diary, please let us know by emailing us prior to therapy commencing. It may also be helpful at this point to go through some expectations regarding our therapy programme. As I mentioned earlier, what we are offering in our service is a self-management approach. You will need to be open and willing to make lifestyle changes to support self-management of chronic fatigue symptoms. Therapy is a commitment, and you will get the most out of therapy by preparing for therapy, engaging in therapy sessions and putting into practice what has been discussed during therapy appointments. Action points will be agreed between yourself and the therapist at the end of each therapy session. For example, it may be working on applying sleep hygiene strategies or making time for rest or relaxation breaks as part of your daily routine. It is also helpful if you come prepared for therapy. Have a notebook and pen to hand so that you can jot down any points discussed during the therapy sessions, which you can then refer to. Taking notes will also help to identify where additional support is needed, as well as seeing where positive change has been made as part of your therapy journey. If you need to cancel your therapy appointment due to illness or unforeseen circumstances, please let us know via phone or email as soon as possible. Email and telephone numbers are shown on our appointment letters. As we are an appointment-led service, the more notice you can give, the better, so an alternative appointment can be arranged for you. As therapy draws to a close, hopefully your knowledge and understanding about fatigue and fatigue management tools and strategies will have increased, and you will be feeling better equipped and more confident about how to self-manage the fatigue symptoms more effectively. Managing fatigue is an ongoing process, so you will need to continue to apply fatigue management principles as part of your daily routine once therapy has ended. If you find you are struggling to stabilise and manage the fatigue, please refer to your own notes and the self-help resources that have been provided to you. At the end of therapy, there will be time for you to reflect on your therapy journey and complete outcome measures to see where change has occurred. And this can also be a helpful way of identifying if you may need any additional support from other services, For example, talking therapies if you are struggling with low mood and or anxiety, for example. Your GP will also be informed that you have been discharged from our service back to their care. I appreciate quite a lot of information has been shared with you today about our therapy programme and what you can do in preparation for therapy commencing. So thank you for listening.